So, a few days before your period, something takes over. You don't just want chocolate, you need it. Like your entire body is demanding it. You've tried resisting, you've tried telling yourself it's just a craving, but the pull is so strong it feels physical because it is. So, for some of you, this is a real reality. I'm going to show you exactly why this happens, what your body is actually asking for, and why some women experience this so much more intensely than others. So, let me describe what women tell me every single day. The week before my period, Dr. Phyllis, I become a totally different person. I can't sleep unless I eat chocolate. Or they'll say, I have control all month until those few days and then it's gone. Or they'll say, I've driven to the store at 10 p.m. because the craving was unbearable. And Dr. Phyllis, it's not just sweetness, it's specifically chocolate, even dark chocolate. And then comes the shame. Am I addicted? I have no willpower. I ruined my whole month in just 3 days. And here's what I want you to know. None of this is a character flaw, and none of this is a psychological weakness. There's a specific measurable biological cascade happening in your body before your period, and chocolate happens to be one of the most efficient biochemical solutions. Stay tuned to learn more. So to understand premenstrual cravings, we have to understand the hormonal shift before your period. So I'm going to walk you through the cycle. Day 1 to 14 is a follicular phase. Estrogen is rising and you usually feel your best. Day 14 is ovulation, peak energy, best mood, highest libido. Day 15 to 28 is your luteal phase. Progesterone rises, estrogen dips, and they both crash before your period. It's this crash, the sharp fall in estrogen and progesterone, that triggers the cravings. So here's what falling estrogen does to your brain. It's important to note that estrogen modulates serotonin, dopamine, GABA, endorphins. So when estrogen drops, your serotonin drops, causing low mood, irritability, and carb cravings. When your dopamine drops, your reward seeking goes up. When your GABA drops, anxiety rises. When endorphins drop, your pain tolerance is lowered and you increase your emotional sensitivity. This is why you feel less stable, less patient, and more impulsive. Serotonin is made from tryptophan, but tryptophan needs help crossing the blood-brain barrier. Carbs trigger insulin, and insulin clears competing amino acids, and tryptophan finally can get into the brain, allowing your serotonin to rise. And your body knows this, not consciously, biochemically. So if you have low serotonin, you crave carbs so that your serotonin can rise and you feel better. This isn't emotional eating, but this is neurochemical self-regulation. So why chocolate specifically? Well, chocolate contains sugar, which helps increase your serotonin, fat, which gives you that feeling of satiety and satisfaction, theobromine, which is a mild stimulant, phenylethylamine, which leads to dopamine, anandamide, magnesium, which calms the nervous system, tryptophan, which is a serotonin precursor. So chocolate is a multi-pathway neurochemical booster, and your brain remembers that it works, and it will ask for it again and again. So what's the magnesium connection? Magnesium will actually drop premenstrually due to hormonal shifts. Low magnesium leads to cramping, headaches, anxiety, insomnia, irritability. And actually, dark chocolate is one of the richest food sources of magnesium. So your craving is partially a biologically intelligent mineral-seeking behavior. Your cravings always tell a story. Now, progesterone's role is when progesterone drops, your appetite actually increases. The calming GABA effect completely disappears, your sleep worsens, anxiety rises, and your metabolic rate increases in the luteal phase, meaning that you generally actually need more calories. So now we have lower serotonin, lower progesterone, higher metabolism, increased need for calories, lower magnesium, and unstable blood sugar. So of course your cravings intensify. So let's talk about blood sugar instability. Insulin sensitivity changes. Premenstrually, you have more spikes, more crashes, more cravings, and you also experience blood sugar volatility. Low serotonin, low magnesium is the perfect trifecta for pre-period chocolate cravings. So why do some women experience cravings mildly or not at all, while others are completely derailed by them? It's because of your genetics. It determines how severely that serotonin drop is, how strongly that dopamine falls, how well your estrogen is metabolized, how fast magnesium is lost, or how fast magnesium is absorbed in the first place, how stable your blood sugar is, how intense hunger signals are. And this is why the same hormonal cycle can give different women wildly different experiences. So when we look at the serotonin genes, there's variants that make women have a lower baseline of serotonin, which means a stronger dip premenstrually, more mood changes, and stronger gene categories. And when it comes to dopamine genes like DRD2, DRD4, and COMT, these variants have higher reward thresholds. You need more stimulation to feel satisfied, a stronger pull towards chocolate, and using chocolate to help regulate your dopamine levels. Now, when it comes to your estrogen variant genes, there are some variants that cause your estrogen metabolites to linger, which causes bigger hormonal shifts, more PMS symptoms. And then when it comes to specific magnesium gene variants, there are variants where your magnesium is actually lost faster and you have a lower baseline, causing a dramatic premenstrual drop and stronger chocolate cravings. When we look specifically at blood sugar gene variants, these can cause unstable glucose, more hunger, and more cravings. Lastly, when we look at specific appetite genes like MC4R or FTO, these can amplify premenstrual shake signals. So for example, you have woman A versus woman B. Woman A can have mild cravings, woman B has intense cravings, binge patterns, emotional distress, same cycles, but different genetic variants. Not willpower, not discipline, biology. And so here is why generic advice fails. Sometimes people say just don't keep chocolate in the house. This fails if cravings are neurochemical, not just behavioral. It's just emotional eating. No, it's serotonin depletion, dopamine drop, and magnesium loss. Use willpower. This is impossible when serotonin, your impulse control neurotransmitter, is low. Eat fruit instead. Fruit doesn't fix your neurotransmitters. It's just PMS. No, it's genetic. Take calcium. This doesn't help magnesium dominant patterns. Here are the changes that you need to know. There are some women that are serotonin dominant pattern. They need targeted serotonin support like tryptophan, 5-HTP, B6, vitamin D, omega-3s. And then there's the magnesium dominant pattern. They actually need a specific type of magnesium repletion. Glycinate, furanate, baths, food-based sources, depending on your genetics. And then if there's a blood sugar dominant pattern, then you need to focus on inositol, chromium, and certain eating patterns. So there's multiple genes, multiple possible interventions, but when put in place means massive symptom relief. Your cravings tell a story. And when women support these pathways, cravings shrink, mood stabilizes, and your cycle becomes predictable. So the truth is that cravings are biological, not moral. They don't make you good or bad. And truth number 2 is that the intensity of your cravings is genetic. 3 is that you don't fight your cravings. You support the pathways driving them. And truth number 4 is that you work with your cycle, not against it. Your cravings are not random, they're signals. And once you understand the pattern, you can finally respond and give your body exactly what it's looking for, not just react. Remember that you're not weak, you're not undisciplined, you're decoding a genetic pattern most women never ever learn about. So when you understand your serotonin genes, your magnesium genes, your blood sugar genes, and your estrogen metabolism genes, everything becomes predictable. I'm Dr. Phyllis, and I help women understand the biology behind their cravings, cycles, and weight so that they can stop fighting their bodies and finally work with them. I also created a genetic readiness training that walks you through our proprietary genetic avatars and helps you understand which patterns may be driving your weight loss resistance. The link is in the description, or make sure to subscribe for more.